much. And then start to clear, and by third day the rash is completely gone. Again, there is the spelling of the palm and sore. Remember that palm and sore is syphilis, right? Remember that. And sometimes there are some enanthems, like for example, macules or petechia on the soft palate on the back of the mouth. That's called Forchheimer sign. These are the name. You don't need to remember that, but just remember that there is an enanthem over here as well. Rubella has a little bit tricky complication. Comparing the severity is much milder than the measles, but complication-wise, it has a tricky complications. So first of all, it can cause arthritis. This arthritis happens mostly in the adults, mostly in the women. The story is like that: the child in the house got the rubella, and the mother develops the joint pain, the knee pain, because the virus can cause, for example, some sort of knee arthritis, and again it can cause encephalitis, thrombocytopenic purpura. Again, in the pregnancy, it can cause the congenital rubella syndrome. It is part of this torch complex. Do you know what is the torch?
Yes.
What is that one?
Disease common to pregnant women.
Anybody else?
Toxoplasma.
Toxoplasma, O.
Rubella. Oh,
This is
O is
rubella. This is one.
CMV.
Okay. Herpes.
Herpes.
Yeah. And what is the O?
Other.
What is the other? Syphilis. Yeah. Right.
Thank you.
So, if the infection happens during the first trimester of the pregnancy, you will get congenital rubella syndrome that has a theory, classic theory of deafness, cataract, and heart defect.
How much the blazer?
Sorry, is disease common to neonates? Catch. Sorry.
It's not common. It's not common, but these are heavily affected the fetus. So you will end up with some congenital deformities. Again, to grasp the idea, if you got married and you got a baby with, for example, deafness, cataract, the whole life of that baby and the whole life of you and your family and even future babies will be affected. So it is a big issue, right? And you cannot kill the baby. You said, okay, this is rotten, I don't want it. You have to keep it, right? You have to take care of it. It needs money, it costs, and it never gives you the pleasure of a baby. And as I told you, your whole life and even the future babies, the whole family will be involved. So this is a big issue. For this reason, they try to recognize what are the causes of this and try to prevent this, because this creates a drama in the people's lives, and also it has a huge cost burden on the healthcare system. For this reason, they separate it, because you have to have a tangible sensation of what it means that you have a child with disability, right? So for this reason, they separate it. It's not because they are common, because they are important medically. So remember the congenital rubella syndrome, the triad of the congenital rubella syndrome: deafness, cataract, and cardiac problem, right? So this is the triad, don't forget that one. Also they will have some growth retardation, hepatosplenomegaly, and this is again a skin rash that sees up most of these torch people. This is called blueberry muffin. So you will see some red nodules on the skin. What are these? This blueberry muffin. These are foci of extramedullary hematopoiesis. Basically, the skin starts to produce red blood cells. So you will see in these congenital disorders, this is called blueberry muffin. So if you see, this is one of the characteristics of this torch complex and congenital rubella syndrome. Extramedullary hematopoiesis. Okay, so for the diagnosis again, same story, there is no specific treatment, and again we have this vaccine, MMR vaccine. I hope none of you are anti-vax group, because this will help save lives and save life of the people, right? So, another disease in the same class is erythema infectiosum. It's called fifth disease, right? What are the other four? We come to the fifth.
We
What are
have
the other four?
six disease.
The sixth is after that. What are the other four?
Measles?
Measles is 1, 2,
Rubella.
rubella is 3.
This is the parvovirus, right?
E?
Yeah.
Is it a EBV?
No,
Yeah,
no,
19.
no. So this was a classification old, so for this reason you need to know. You know, try to see or read whatever, understand what it is, because then they will not forget, right? So the first is measles, the second one is scarlet fever, the third one is the rubella, the fourth one was the misnomer that is not available because it comes by many diseases. This is the fifth, and there is another one, the sixth. These are the 6 exanthematous childhood disorders, right? So this erythema infectiosum, it's the Parvovirus B19, and then again same story, spread from the respiratory droplets, affect usually the children, and then at the prodrome you will have a low-grade fever, some symptoms related to upper respiratory tract. When the rash appears, it's like a erythematous patches that covers the cheek and spares the perioral area and the chin. You will see the perioral area and the chin is not involved, right? This goes a little higher. So this is sparing the perioral area and the chin. So it is only on the cheek. For this reason, they may say as a slapped cheek appearance. If somebody slapped the cheek, right? So you will see redness only on the cheek. So this is the beginning rash, and then you will have a reticular rash that covers the upper part of the body and even the upper extremities. One characteristic of this erythema infectiosum rash is that the rash can recur after different stimulation, like for example a change in temperature or exposure to sunlight or exercise or emotional stress, the rash comes back again. So this is one of the characteristic or typical feature of erythema infectiosum. So slapped cheek appearance, sparing the perioral and chin area, plus reticular macular papules and the upper trunk and extremities is a typical presentation of this fifth disease. There are other presentations with this Parvovirus B19. One important point about this parvovirus is that it replicates inside these erythroid progenitor cells in the bone marrow, right? So the parvovirus replicates in the progenitor cell, erythroid progenitor cell, the cells that are producing the RBC in the bone marrow, right? So one important complication is this aplastic crisis in the people who have some sort of hemolytic disease. People, for example, have sickle cell disease, they have hemolysis and they're dependent on this production of the RBC to replace the least RBCs, right? So if any viruses affect that production, they may end up with the aplastic crisis. So again, in this sickle cell disease people or any other chronic hemolytic disease, this Parvovirus B19 can cause a real problem. Also, again, like Rubella, it can cause arthropathy again. It can cause arthritis or arthralgia. Even there may be no rashes, just a comes with a complaint of this joint pain. This is more common in adults and also especially in the women. If it happens during the pregnancy, again, it can cause a serious problem to the fetus, like a hydrops fetalis, or for example, miscarriage or cardiomyopathy due to fetal anemia. Again, remember that is replicate in the erythroid cells. And then there is a specific reaction to this parvovirus B19. It is called popular purpuric gloves and socks syndrome. The name is self-explanatory. It means that we will have some purpuric rashes in the gloves and socks distribution on the hand and feet. And sometimes it's accompanied by some edema. Sometimes they may have some oral lesion as well. So this popular purpuric gloves and socks syndrome, you will see a patient comes with swollen hands and feet only with some petechial rashes. So that will be a cause caused by the Parvovirus B19. It's a very typical, again, something exciting presentation that comes with the hand and feet, right? This is one of the diagnoses that if you made it, it makes you outstanding about all your colleagues. So that's it. I find that one. Okay, so diagnosis clinically, you can do the serology, and then if somebody has immunocompromised, or for example, in these people who are have issue with this hemolysis, you may use, for example, IVIG to reduce the severity of the infection. Other than that, you can go for supportive treatment. There is no specific treatment for that. At the same way, we have another syndrome called acrodermatitis of the childhood, or Gianotti-Crosti syndrome. This acrodermatitis of the childhood usually caused by many viruses. Epstein-Barr virus is the most common one, but it can be caused by the hepatitis virus or other viruses like the CMV, respiratory syncytial virus, and Coxsackie and others. And usually it's presented with erythematous papules or papular vesicles. They are usually not very itchy and typically involve the face, buttock, and extremities. Face, buttock, and extremities. It is in the children. It's called acrodermatitis. Acrodermatitis, acral means end. So it's end part of the body. You see on the arms and hands and leg. You will see on the buttocks, that's basically one end of the body, and on the face, this is another end of the body. So in acral distribution in the children, causes by many viruses, Epstein-Barr virus is most commonly associated. Now we reach to the sixth disease, the Roseola Infantum. This is caused by human herpes virus type 6, less commonly type 7, and then affect the children between the age of 6 months and 2 years. And this is a very interesting disease as well, because it starts with a high fever, usually 39 to 40 degrees, that lasts for 3 to 5 days. And the day the fever subsides, the rash appears. So usually the mother brings the child with a rash and say that the child was feverish for the past 3-4 days, but today the rash appears and the fever is gone. So this is the Roseola Infantum. It's very easy to diagnose. There is no specific treatment because when you see the rash, basically it's at the end of the disease, so you don't need to do anything. And sometimes they have an enantiomer, that's a very unusual name as well, Nagayama, but let's keep it like this. Another disease that happens in the childhood is this, again, hand, foot, and mouth disease. Again, this is self-explanatory name. It affects the hand, the feet, and the mouth. HFMD, that's usually caused by the Coxsackievirus A16 and Enterovirus 71. Remember those names of the viruses, right? A16 and E71. Transmission can be fecal oral or can be, for example, from the respiratory droplets. Usually it comes after the incubation period of 3 to 6 days. There is a prodrome, and the typical lesions, they have the child's come with these painful vesicles on the oral mucosa and some vesicular rash on the hands and feet. The characteristic lesion of this HFMD is oval-shaped vesicle. Most of the vesicles are not round, they are oval-shaped. When you see this oval-shaped vesicle, this is a characteristic lesion for the HFMD. Usually by the healing, there is a desquamation, and there is some atypical form that comes with another virus that's called A6. This is a recently epidemic, especially in Europe, that it affects the older people and comes with a more severe and widespread lesion. Even it can cause large blister instead of the vesicle. So blistering lesion in an adult with the sign of the infection like a fever, headache, lymphadenopathy, you can think about this HFMD again. But what you will see mostly is non-specific viral rash. They bring a child, there's a fever, and you will see this morbidiform rash, but it doesn't fit any of these specific characteristics that we say for these diseases. It can happen for many viruses that can cause this one. For example, like enteroviruses in the summertime or respiratory viruses in the winter time. And then usually they subside in a matter of 5 to 7 days. So this is the mostly you will see that will be a non-specific viral rash. You will see a fever, a child with a fever and a morbidiform rash. Okay. Do you want to have a little break, 5 minutes, and then we continue? Or you can go, because we are going to shift the gear to the viruses that cause proliferation of the epidermis. We may need 20 minutes. You want a 5 minutes break?
Yeah.
That's okay. So we stop there, you come back in 5 minutes.
Thank you. I wish we had the 8 a.m. lectures for micros.
So you're going till 12? Yeah.
Yes.
This is making
We're making up for it.
Yeah.
All the way to
Yeah,
12.
that's true.
You're right? No.
No,
I
it's
know.
not
I know.
great.
It's the 1%, but you know?
Difficult?
It's a good self-certificate.
It's a good
No.
self-certificate.
Oh, yeah.
Your hair fell off. I guess it hit you before it hit me.
To hair. It is with hair right now. And
Oh, it's
then
fresh, so it
we
looks
get
nice.
another 4 after this. I really forgot. I have the proof. I have the proof here.
No,
I can
because
show it.
it's good. This is fun. Yeah, how are you? How are you? Yeah,
Did you take the others?
You can ask her, it was already given.
I just wanted to.
Maybe today, because yesterday
I slept like this radio.
Yeah.
We're gonna throw it out after.
Exactly. I'll take a picture of it though and put it into my notes.
Really? I would never.
Stressful. And that was such a different time. I need to come back to the work.
Well, I have to do it in my 30s. A second thought, no. A second thought, no. My aura will stay behind. Wow. 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 That's deep. A few of us have another lecture at 9:30.
I ask and they say that they are free, they don't have any class, but if you have lectures, you can free to go. It's okay.
It's just.
It's okay. It's okay.
Do we have a lecture with you tomorrow too then? Because you're Dublin lecturing today?
Yes.
Okay.
Basically, I supposed to be here until
Next week?
next week, but there is a holiday coming. They say Thanksgiving or something. There is one holiday.
We get Thanksgiving off?
So
Do we?
we cut
I'm
short
making a
for
turkey.
one day, so for this reason I do that lecture on that day today.
Today. Okay, that makes sense.
But from tomorrow again, every day we will have one lecture. The last
Are
one
you
will be
inviting me to
on
Thanksgiving
Tuesday.
dinner?
So basically we have Thursday and Friday, and then Monday and Tuesday, 4 more lectures.
So what are your plans on the weekend then?
Yeah, that's four.
No plans. I have 3 things to do. One, the course that I'm teaching in Toronto, the students over there, they have to do the exam, so I take an online exam from there. And I have a webinar to attend, and I have webinar to lecture. So there are 3 different things that I should this weekend. And that's it.
The rest is relax on the beach.
Your lock's not locking. No, no.
I'm a crazy old man.
Tour guide on the way.
Goat or sheep, and if working on those area, you may catch that one. This is a very outstanding presentation because it goes from, it's a little bit, it has a long course and goes through several stages. It starts from like a small red papules at the beginning, then progress to a vesicle, then progress to a pustule, then progress to the nodule, and then finally they become dry. So each of these stages take around a week. So but this is a typical, again, bull eyes appearance of the lesion on the hand of somebody who is dealing with this animal is a characteristic of ORF lesion. And the Mpox, the Monkeypox, the one that is recently got attention of the medical society because of this new outbreaks happens. Here the lesion is somehow similar to smallpox. We see all the lesions are in the same phase, contrary to the chickenpox that they are on different phases. They are all lesions on the same. It can come from the respiratory droplets or direct contact, and the incubation period is about something around a week, but it can be even up to 3 weeks, and then start with some sort of prodromal symptoms, and then the lesions start like macules, and then progress to papules, vesicle, pustules, and finally scabs. It affects every bed, including the palm and sole. You will see the some lesions on the palms. So this Mpox is currently is a hot topic in the medical community because there are some outbreaks from the Africa, and in the America it's seen mostly in the homosexual men have sex with men. So in this category mostly seen, but they expect that may spread to the other groups as well. Okay, let's see what we have in next. So the dermatologic manifestation of COVID-19, I think everybody is familiar with the COVID. It can cause a myriad of these different skin rashes, borbiliform, hives, varicella-like, livido-reticularis-like, purpuric-like, and this interesting one is this permeol-like or COVID toe that usually happens in young people, usually denotes a milder disease, and usually happens at the end of the disease course. So appears in the later stages. So the COVID toe, don't forget that one. Okay, let's see what we have. One of the dilemma, again, when you are in the ER, is somebody comes with a fever and rash. So if you want to make a workout open, if you think about the infectious cause, because as I told you, fever and rash could be, it could have another causes, for example, like a drug reaction can cause the same thing. But if you think about the infectious cause of this fever and rash, you can make a differential based on the type of the lesion. For example, if you have a maculopapular rash, or it's a vesicular rash, or it's a petechial, or for example, it's like an erythema multiforme, or it's a bullous. So if you categorize what type of rash you are dealing with, then these are the possible etiologies and the clinical group. This presentation will be given to you, so you will have this table later on, so you can go through this. It will guide you in if you are dealing with any case of the fever and rash. Is a good table to help you to understand what you are doing. Okay, so we stop here, and then we are going to have again a 10-15 minutes break. We go back and we go to the second part, that will be fungal infection, and there will be a last part at the end of the day for this treatment and other stuff.
Thank you.
Thank you.
So any question about what we talked today?
Not yet.
You know that sexually transmitted disease is a part of the dermatology because usually they come either with rashes on that area or ulcers. And so when you see again anybody with some sort of this STIs, sexually transmitted disease, first of all, you should remember that most of these diseases come together. So if you recognize one of them, you have to investigate the patient for the other diseases. And also it's very important to educate the patient beside your treatment, the importance of having a safe sex and also investigating the partner, because again you have to convince that if you have this disease, you need to go and tell your partner or partners that you had this disease, they have to go and check. So this is a conversation that regarding the infection prevention is very important. So just to remind that because we talked about some of this genital disease, this is good to bring up. Yes?
It's not a part of urology?
We are shared with urology
Okay, yeah,
something, yeah, because the part that is related to urethritis, because that is another cause spectrum of the sexually transmitted disease like gonorrhea, like chlamydia, that
Yeah.
usually they involve the urethra. This goes in the field of the urology, but the things that come on the skin, because then this comes in the field of the dermatology, because the people come to the skin specialist because they think there is something on their skin. But if, for example, they have a dysuria, pain in urinating, they definitely go to the urology. But this is an overlap, and you know that there are some specific clinics that they are dealing with genital or sexually transmitted disease in total. It will be a subspecialty, whether you can go from internal medicine or urology or dermatology, that you cover everything under one umbrella. But generally, the urethritis part goes to urology, the skin disease comes to dermatology.
I'm gonna come back in 10 minutes. Thank
Yeah, there's 10 minutes. So, 10 minutes. Anytime.
Happy birthday to Lisa.
Okay. It is hard to listen all this story, but much harder to talk.